In this video, I'm going to go over an acute sprain to the LCL ligament of the knee. Now, the LCL ligament's on the outside of the knee, so it's a smaller ligament here on the outside. The MCL, as in comparison, is here on the inside, and the LCL here on the outside is much smaller. And so what we're going to go over is what are some techniques you can do acutely, after this has recently been sprained, maybe a grade 1, even a grade 2 sprain, and your doctor has cleared you to go home and go through some exercise and movement, try to regain some range of motion. So we're going to go through 9 different techniques you can do to try to improve your range of motion, decrease your pain, and improve your strength. The first thing we're going to do is an assisted heel slide. Now I'm going to use one of these straps here that you can buy. They're pretty inexpensive, but if you don't have one of these straps, you can just use a towel or a sheet, whatever you have at home. I'm just going to put this around the bottom of my foot. We're going to say it's my right knee here that's affected. Kind of cross this around, and I'm going to work on sliding my foot back up towards me, just like this, known as a heel slide. And I'm just helping to pull my foot back when I come back, because initially range of motion typically is going to be pretty limited. Your knee is going to be flexed a little bit. It doesn't want to go down flat, and it's definitely difficult to bend and pull your foot back underneath you. So you're going to repeat that for maybe 10 to 20 repetitions, 2 to 3 times just throughout the day. Now, using the same strap, we're going to work on hamstring stretches. So what I'm going to do here is just pull my foot back, try to flatten my knee down as much as I can, and pull back on that strap. Just really just kind of sinking into that stretch. Initially, just kind of be easy with it, and then you pull a little harder. I'm going to work on trying to hold that somewhere between 20 to 30 seconds, and I repeat that several times a day. Next, we're going to perform what's known as quad sets. So you're going to roll up a towel, put it behind your knee, and you're going to focus on trying to push the back of your knee down, or the back of your leg down into the towel. Kind of compress that down, tighten up your thigh, and at the same time, pull your foot back up to you. So you're kind of pushing down, really focusing on tightening up your thigh here and contracting that and pulling your foot back. And you're going to do that for 2 to 3 sets of 10 to 12 repetitions, and try to hold that each time for maybe 2 to 5 seconds for each repetition. These are going to be assisted knee extensions. So you're going to take that same strap or towel or sheet that you have, put it around the middle of your foot here. You're going to work on kicking out your foot, straightening out the knee. At the same time, you're going to pull a little bit with the straps. I'm really doing most of the work myself here, contracting my thigh muscle, trying to kick my foot out there, and I'm pulling just a little bit, giving a little assistance while using the strap. And you complete somewhere between 2 to 3 sets of 10 to 12 repetitions. Next, we're going to complete leg extensions with using a leg weight or a cuff weight that I have here on my lower leg. And you're just going to focus on tightening up the thigh, straightening out the knee, and at the end of that movement, pull your foot and toes back up to you. You're going to feel all of this contract on the thigh. You should feel that out here on your shin when you pull your foot back, and just come back down nice, slow, and controlled. You're going to repeat this for 2 to 3 sets, 10 to 12 repetitions. Now we're going to perform mini squats. You want to hold on to something, make sure that you're nice and stable. You don't want your knee to collapse or you to fall. I'm just going to hold in the back of the chair here, put my feet, whatever feels comfortable, and I'm going to go down in a mini squat, just kind of down and back up. Make sure you hinge at the hips first, and then you kind of bend your knees and go down. And you can progressively work up to not holding on the chair, going down in a full squat. It just kind of depends on how much pain you're in, and also how stable that your knee feels. You're going to want to complete 2 to 3 sets of 10 to 12 repetitions. Also, something to mention when performing this exercise, or any exercise really where you're not able to sit down, where you're having to stand, you probably would want to wear your knee brace. If you have a knee brace, if you don't have one, talk to your doctor or your therapist or medical professional about a knee brace, something that's going to help stabilize the knee while you're going through your strengthening program. Now we're going to use this band to perform what I call step outs. And so we're going to put this around our lower leg area and then just step out to the side, kind of straining a little bit and stressing, putting a load on that LCL ligament out there, just to try to introduce this load to promote healing, as well as start to return some motor control. So I have the band here in my lower leg area, and all I'm going to do is step out and back, out and back. Now, of course, we're going to say this is my right knee, my right LCL that has been sprained, and so I'm coming out just like that. And I'd complete somewhere between 2 to 3 sets of 10 to 12 repetitions. Next, we're going to work on focus walking. And so you're going to walk forward. You're going to really focus on hitting your heel first, rolling through your foot, and then pushing off your toe. Just really making sure that your heel's hitting first, you roll through and push off your toe. So basically what you're going to do is you're going to find either a distance that you have set up, maybe it's down your hallway at home or whatever, and you're going to work on my heel hitting, rolling through, pushing off my toe, then the other foot, heel hitting, rolling through, pushing off my toe. And I'd complete somewhere between 2 to 3 sets of 10 to 15 repetitions, or 2 to 3 sets of maybe that pass, if that is, say, 10 feet, 15 feet, whatever your distance is that you're working on. Our ninth and final technique is going to be backwards walking. So what you're going to do is just the opposite of the forwards focus walking. You're going to focus on going backwards. This time, your toe is going to hit first, or your toes are going to hit first. You're going to roll through and then push off your heel. And you're going to do the same thing on the other side. You're going to really focus on making sure when you walk back, the toes hit first, you roll through, and as you roll through and rock back onto your heel, you're going to really think about straightening out that knee. Really focus on straightening out the knee, rolling back on the heel or rocking back on the heel, and then stepping back with the other foot. And just like with the forward focus walk-in, I complete this for 2 to 3 sets of whatever distance that is that you're working on, or repetitions. However you set that up is fine. You just want to make sure that you do both of those every day. This entire program overall is designed to be done within the first 7 days after your sprain, or as soon as your doctor or medical professional clears you to be able to do so. You typically can start doing some of these techniques, as they're generally safe. As always, though, make sure you talk to your doctor before you participate in anything that's in any of these videos. Thanks so much for watching this video. I hope it helps with your LCL sprain to improve your range of motion, decrease your pain, and increase your strength. Thanks so much.